Hi everyone. Today in this video I'll be sharing with you all a recent case of genital cyst in a male patient. This patient presented with a cystic lesion on the genital area and was advised to undergo surgery for the same. So, as a last resort, the patient's daughter asked me if I could help in giving some sort of relief in this case and trying to delay surgery as much as possible. The most important aspect of this case was that the patient was not actually troubled by the complaint, but just because of the insistence from his wife to visit a surgeon and to get an opinion of the surgeon, the person agreed, visited the surgeon, and because of the insistence of the wife to undergo surgery, he was ready and had already taken the date for the surgery. This patient's wife is under my treatment for endometriosis and is a very dominating female. She's on lycopodium, so you can imagine what kind of atmosphere it will be for the husband at home, who is mostly dominated by the wife. So, in this case, what is most important for us to understand is we need to reach the patient in disease. Just because of the nature of the pathology, we must not decide the medicine that is to be administered, and we must give foremost importance to the indication. The medicine that I prescribed in this case was a single dose of Thuja occidentalis 30. The result was that in less than 7 days, the cyst almost completely disappeared. Now, what is most important is how did we reach Thuja in this case? It is a trend these days to feed all the symptoms that you see in the patient, get the repertorial analysis, and just give the medicine that is coming out as the predominant medicine. But what is most important for us to understand is that at times a single symptom can amount to the entire totality of the case. The condition is that that symptom should be striking and should be persistent in the patient. I chose a single rubric in this case under the mind section of synthesis repertory. Comply to the wishes of others is obliged to. The two leading medicines given under the rubric are Magmure and Thuja. Now, how to differentiate both these remedies? We know Magmure has the predominant orphaned feeling of the magnesiums. So, why will Magmure want to comply to the wishes of the others? It is because Magmure wants the love, wants the nurture, wants the nourishment of love, and so it does not want to lose that love. So it becomes submissive and agrees to comply to the wishes of others. Whereas in Thuja, what is most important is that Thuja is very dogmatic. Thuja is very routinist. So anything goes out of line in the daily routine and Thuja is greatly perturbed. So that is why, in order to maintain a cohesive environment at home, to maintain the peace of mind, Thuja is willing to comply to the wishes of others. It is not just important to look for a rubric, give the medicine in the highest grade, without differentiating between the medicines and without understanding what that medicine is doing in that rubric. We may have any repertory at our hand, but until and unless we have a sound knowledge of materia medica, it is of no use. We will just have a hit and miss, and we cannot be certain about our prescribing unless we are having a basic threshold materia medica in our mind. So this was a recent case that I came across and thought of sharing with all of you. Stay tuned, I'll be sharing many more cases and would encourage everyone to share as many cases as you can, and especially cases with references showing a different facet of the medicine and enhancing everybody's knowledge. Thank you. Have a great day.